doctor, what makes one business more expensive than other, one place more expensive than other? I was researching about the NeoGraft model machine, and I believe that was one of the reasons for the black market to start. That's something related to this. Do you think that there's something that kind of the bad apple inside the basket?
That's a great thing you bring this up because, not to single out NeoGraft, but we all know it's out in the open that that model that they started proposing a few years ago was what started to drive this black market, and then on their heels came other companies too that are now, what they do is they go to, let's say, a plastic surgery conference and they buy an exhibitor's space and they bring the machines there with some salespeople and they tell the plastic surgeons, look, you can add hair transplant surgery to your practice. It's a $50 billion industry. I can offer you a piece of that very easy. You just buy my machine. Here's the price of that. You don't have to do anything. I will advertise for you. I will send the staff to do the procedure for you, and I'll take care of everything. You just do it. I mean, you just put on your website that you do hair transplants. You don't have to do anything. We will take care of everything for you. And so that became very popular because it's very attractive. If I'm a plastic surgeon and I have a room in my office that's not being used, well, now I have another procedure I can do. And if this company is proposing to me that I don't really have to do anything, I can have their technicians come in and do it.
And why would liability goes to them?
Theoretically, right?
Yeah.
But remember, and that's another thing that we're working too, is educating the doctors, because the liability lies on the physician, right? If you are in my office and is my name on the door, it doesn't matter what happens inside. If you have a problem, at the end of the day, it's going to come to me because I'm supposed to watch out for what's being done under my name, right? So if I have a room here, I'm doing a facelift in a room and then my technicians are doing a full transplant with a NeoGraft or whatever else device in the other room, and that patient has, let's say, a heart attack and has a problem and dies, the technicians may be in trouble, but at the end of the day, it's my license that's going to be affected. It's on me, right? Not only the guilt that I'll feel about the patient, right? That's of course major, but it's the legal implications. And so these doctors are opening themselves to huge problems, and that's another thing too. That's another message is to the public and to the doctors. By doing this, you're really risking your livelihood, risking your career. I don't want to lose my license to perform the thing that I've been training for my whole life because I just wanted to make a few dollars, and these doctors are doing that. And sometimes what happens is you have a few bad outcomes from the transplants that they allow to be done by these technicians, and now all of a sudden these patients start putting reviews out there and everything. Then it affects their other practice, the other part of their practice that was successful to begin with. And so for a few dollars, they're risking their entire reputation and their license, because again, with this grassroots work with the Fight the Fight campaign, the government is more aware of it, the state boards are more aware of it, and we're going to start seeing more of these things popping up here and there where people are arrested, physicians got their license suspended or under investigation. Nobody wants that, And the problem is the people that suffer is the patient. Because once you have a bad outcome, it doesn't matter to me if I'm a patient with a bad transplant. I don't care if the doctor loses their license, right? That doesn't affect me. What affects me every time I look in the mirror and I see that work that was done, and now I have another problem, which is trying to fix it, And so it's a 360-degree sort of circle that goes around and around. And when you start seeing patients coming in with terrible work, terrible planning done, and you have very few options on how to correct it, it makes you feel terrible. If you care about your specialty like I do, it makes you really feel terrible and pissed, to be to say it bluntly. You get mad because people shouldn't be doing that to other people.
So I had a problem. I had a bad outcome. Now I'm looking for more like the 3 Stooges instead of
corrective surgery.
Brad Pitt. Mm-hmm. And what should I do?
That's the thing, you know, back in the day when the only technique we had was the strip procedure, where we take a strip from here. It's called FUT, or LSC, linear strip excision. Anyway, it's the technique where we take the strip of hair from here, then we stitch it up, and yeah, it leaves a small scar right in the back of the head. That's called now, is known as maybe antiquated surgery and everything like that. It's not. We still do it all the time. But back when that was the only technique, we had options. You had a patient who had maybe some bad outcome here. You still had a lot of hair back here remaining for you to work with to fix that problem. Then the FUE, or follicular unit excision, came in the market, you know, maybe 20 years ago, 15 years ago. And that's when NeoGraft and all these other companies started getting a piece of that, because all of a sudden became easy, right? Yeah. You don't have to cut, you don't have to stitch, you don't have to really be a surgeon, you know, to do that. And patients found it very attractive, because you saw on the airline magazines, when they used to be, you know, there used to be magazines in every marketing, they used to put a patient side by side with a scar from the strip and with the FUE, which does not leave a linear scar, it leaves dots, you know. And so patients are like, oh, that's what I want, I don't want that. So then patients started requesting more FUEs. Problem with the FUE procedure is, if you take too many hairs from the scalp at one time and the patient doesn't heal well, there's nothing else you can do, because you actually depleted their entire donor zone of hair, which is the hair that we have available for transplants. And there's nothing else you can do. You can take hair from the chest if they have it, or do other things, but it's never going to be ideal. So that's the main thing. We are seeing patients coming back now with completely depleted donor zones. I have some pictures here if you want to see, I'll show you. Mm-hmm. And that is very difficult, if not impossible, to fix.
But in a legal aspect, on the legal side, mm-hmm. what are my steps if I mm-hmm. want to get even with?
So there's a few resources, right? You can hire an attorney and file a malpractice lawsuit. That's very difficult. What we recommend that you do, if you had a consultation with someone who's not a physician that recommended treatment for you, or if you had surgery performed by no other than anybody else other than the doctor or the PA or the nurse practitioner, like we discussed before, that you inform your medical board, your state medical board, whether you're in Florida, in California, in New York, whatever. Write to your state medical board, because once they get enough complaints that, you know, these people are doing procedures on me, then they're not licensed to do it, then they'll start paying attention, right? That's one thing. And then, of course, you look for someone with experience that can offer you some options to correct it. There are many things that can be done. It takes a consultation with someone with experience, right, to guide you to the steps. It may take more than one procedure. More than likely, it will never be ideal, like you had started well the first time around with a good plan, but, you know, it's not like you're out of options. So, and on that line, the Fight the Fight campaign, we have what we call the International Hair Transplant Repair Day, which is November 11 every year. So I'm a member of that. I'm a volunteer physician. So on November 11 every year, all over the world, there are people like me who offer free corrective procedures for patients who have been harmed by these things. So, you know, and we do this because we want to help out. We want to make people feel better with the bad decision that they may have had, not because of their fault, right? They were led into these decisions. And so it's a way for us to give back and to help, and also to raise awareness, you know.
Fantastic. Yeah. So you that are watching us right now, it's not just about having a bad hair day or having some issues. If you don't speak up, it's really hard to do something without you acting up, or you giving more information for the certified board, for the authorities to do something. We've seen that not just in hair transplant, but a lot of attorneys and a lot of businesses. If you don't get what you want or what you're looking for, and this is wrong, don't be a bystander. Work with it. Speak up. That's the message here. Like Dr. Barusco is here telling you, the gravity, the responsibility, it's so hard for him that works for such a long time. That's what I grasped from this interview. To see people with bad hair, even after paid, I don't know, a couple of thousand, more than that, dollars for a transplant and come back looking like a studge. So if you are in this position right now, please speak up. That's the message of this whole podcast. We want you to understand the consequences of your act and your doctor's act. Don't be a bystander. Don't stay like, okay, it's just me. No, there's a lot of people that has this kind of stuff.
Right. Yeah, and thank you. If you allow me just one more time, talking to your audience here. If you're out there, and you have had if you had a bad hair transplant, even if you had it for free, it's not going to be good. I mean, you don't feel good about it, right? So it's not about the money, really. It's about looking in the mirror every day and feeling good about what you had done, feeling good about your results, and continue to feel that way years and years and years, because hair loss is progressive, it changes, and that's what we think we try to make people understand, is that what I see today on your hair may not be what I see in 10 years, so you have to treat it, right? Not just do surgery. Complications can happen even if the best of hands. I mean, any surgeon that tells you they don't have complications is probably lying to you, because we all do, no matter how much surgery we do. The difference is when I look at you for the consultation, I'm already thinking about the possible problems that I may have, whether because you have a health condition, because you have a heart attack, because you're taking certain medications, or because your scalp is difficult, whatever it is, I can plan for that because of my experience. And as soon as something happens, I'll bring you back and we'll take care of it, because we know how to manage these complications. And a lot of times what happens is you have a bad outcome from these clinics that are just out there to make a buck. And they're not going to see you, or they kind of dispense you because they don't know how to deal. They don't really care about it, So another big part of having someone with a good reputation is that we want the best for you, right? If you decide not to come with me for your surgery, it doesn't hurt me as long as you go with someone that has experience. I'll be happy for you. So it's not like I'm going to try to make you come with me and make me sound very good to you. What I'm going to tell you is what I think is the best for you. Whether you take that advice or not, that's completely up to you. But I want you to be happy with your outcome, whether you have it with me or somebody else. So just be careful, and look. And if you do have a problem, besides what I said, contact the medical boards and everything like that. Contact also the ISHRS, the International Society, because the Fight the Fight campaign, if you go to their website, there's a whole page there where you'll see testimonials of patients that have been hurt by this. So you can be vocal too, and you can help with that. You can help other people avoid the same mistakes that you've done. And that's what we're trying to do also, is to share these stories, because they're very powerful and they can help people make better decisions.
So if you want to have a magical moment, not a tragical moment, just watch again this full video and take notes. That's it, Peter Roman for Porto Orlando. Follow us and I'll see you next time.